Hi everyone, I am Naneshwar Munde. I am today talking about pharmacovigilance terminology. First one is a vaccine PV. The science and activity related to the detection, uh, understanding and communication of adverse event. Following the immunization, other the vaccine of the immunization related issue to the prevention of upward effect of the vaccine of the immunization. WHO is a 2012. Pharmacovigilance, the science and activity related to the detection, assessment, understanding and prevention of ADR and any drug related problem. Minimum criteria for the adverse reaction. First one is an identifiable patient. It is a age, gender, initial date, history. Second is a unidentifiable reporting source, name, contact number, a father. Third is a suspect medical product at least one adverse effect event. And next is the ADR. ADR is stands for adverse drug reaction. Any up toward the united response to the an investigation medicinal product related to the dose administration. Second is a SAE is a serious adverse event. In this, it is not confirmed the adverse reaction due to drug. That is not a sure adverse event due to the drug not have a cause relation with the drug. SAE is the main result of the death, life, and creating hospitalization, prolongation of existing hospitalization. And third is the SAR is a serious adverse reaction. SAR is gives to the confirmation regarding to the ADR due to the drug. That is sure that adverse reaction due to drug. SUSAR is a suspected unexpected serious adverse reaction. And ADR which is occurs during a clinical trial subject with assessed by the investigator or begin unexpected serious and having a responsible possibility of causal relationship with a study drug. And next is the serves effect. The serves effect is the used to the describe initiative of the specific event, that is this reaction has been served. And next is a spontaneous report, a report which are the obtained suddenly, immediately and fast, and a spontaneous report. uh, Two types of spontaneous report, unsolicited and solicited. First one is the unsolicited, no idea about the ADR which occur, and solicited means having idea related to the to adverse reaction which has been occur. And next is the literature. Literature is the medium through which information related to drug and side effect and DF drug is polished. People may be published therefore research, study and marketed drug. That is adverse reaction. Responsibility, any case that means criteria for special requirement for expected submission to the health authority or marketing partner. And next is the HCP. HCP is the healthcare care profession, a medicinally qualified person and physician, dentist, pharmacist, nurse. And next is the MAH, is the marketing authorization holder, the company that has a permission of manufacture of drug. Next is the ICSR, individual case safety report. It is a adverse reaction. Adverse drug reaction is an individual patient and it is a source document for pharmacovigilance. And next is a consumer, a person who is not a healthcare professional, patient, children, lawyer, and friends. A suspected drug, any drug which is mainly patient to be implicate in the etiology of the adverse event. Next is a non-suspect drug, known as a contaminant medication in the general drug which were take at the time of the event, but are the not through the cause it. And next is a past drug. Drug is the completed duration period to the start treatment with suspect drug. And next is a counterfeit medical product. They are the product which is directly with the frequently frequently are misable in the have the same content label quantity and standard drug, but the source been used to uh, cheap and effective or viability manufacture not proper. Next is the drug dependency. Habitual or the particular drug. Drug dependency is the generally occurs after the patient had taken drug long time after high dose. And withdrawal syndrome is the overdose. If drug is taken there or prescribed medicine, then it is a overdose. It may be taken accidentally. Medication error, appropriate use of the medicine. The example is if HCP gives the UX drug and instead of the Y drug, and for make money than the medication error. Suicide attempt is the report where the patient was drugged before the suicide attempts. That is, the drug may have influenced the action. Drug abuse, inappropriate or a wrong use of medicine. Drug interaction, the action of the action one drug upon the efficacy and toxicity of or more drug is the drug and drug alcohol and drug and food reaction. Lack of effects is the failure of pharmacological action after taking a medicine. Placebo. Placebo is the inactive pills and liquid or powder which has the therapeutic activity, not give the any effect. It is used for any mental satisfaction. Next is the INDA. INDA is the investigational new drug. NDA is the new drug application. Next is the off-label use. A drug prescribed the condition other than those approved by FDA behind label trial. It is the trial in which both patient and doctor has the idea regarding to the drug that is has been given. Open label trial. It is a process which both patient and doctor has been a small idea related to the drug has been given. And international birth date, when the particular drug got approval of marketing and selling. The next is the data log point. The the data design the cut off date data is the include the signal detection report. This is a date is a last date of the decline that submission and periodic report by the signal detection. Next is the signal detection. The WHO definition of the signal as the report information possible causal association between the adverse event and the drug. The relation begin unclear or incompletely documented previously. And next is once is the ICSR submitted the periodic safety report has been made from the signal detection, and from the company decide to the conclude that ADR basis of statistical data hence called as causal relationship. Example is the possibility of that drug causing drug. That's all about. Thank you.